Welcome dear student. In one another session, myself Darshana Sandeep Shinde. Today we deals with the autocoids. In the autocoids, we see especially the histamine. Let's see. Learning outcomes of our today's session. After watching this video, students should able to understand and recognize what is meant by autocoids, the functions of autocoids, then histamine, and its pharmacological and physiological effects of histamine. Let's start. First of all, we see what is meant by autocoids. The meaning of the term autocoids itself self-remedies. Autocoid means a self-remedies. These are local hormones with high biological activity and naturally found in the body, either in an active or in the inactive form. In short, autocoids are a self-remedy which our body can do for our immune system, or in a simple words, it's our body's immune system to fight with the allergic reaction. They play an important role in the allergic reactions. Important autocoids found in the body are histamine, bradykinin, angiotensin, 5-hydroxytryptamine, that is serotonin, and prostaglandin. But today we deals only the histamine. Let's see. First of all, we see the functions of the autocoids. Autocoids take part in the inflammation, in allergic reactions, in anaphylactic reaction, but in anaphylactic reaction not so much. Then autocoids take part in the neurotransmission also. Gastric acid secretions, they have an important function in the gastric acid secretion. Then neuroendocrine regulation also. Then apart from that, these autocoids have an effect on central nervous system, and they are responsible for wakefulness, decreased appetite. Decreased appetite is also the reason for, or it's also from the autocoids. Different types of autocoids secreted. That's why person also have the decreased appetite. Regulation of drinking, then regulation of temperature, and secretion of ADH. These are some important functions that autocoid do in our body. Then control of blood pressure, that is one of the important function. All these are the functions which carry autocoid in our body. Then perception of the pain, this one is important. Perception of pain can be carried out by the prostaglandin and histamine also. Then we see, today we deal with the histamines. Histamine is a potent biogenic amine. It is found in the fixed tissue in the mast cell or the circulating basophils. Histamines are present in the mast cell or circulating basophils which are present in the WBC. It is stored in the cells in an inactive form. It is released by the substance which damage the storage cell. If the storage cell is damaged, then histamine is released out from that cell. The most important of these substances are the antigen and the certain drugs. Then we see the physiological role of the histamine. This is not precisely known. It exerts in the body as combined histamine, which is released only by the cellular destruction, as liable histamine, which is released by the physical and chemical stimuli, as free histamine is a very small amount. Free histamine is not found. It is whether it is found, it is in a very small amount. Histamine may play a part in a gastric secretion with the hormone gastrin. It may play a part as a transmitter in the central nervous system also. Then it may also play an important in a tissue growth and repair in an antigen-antibody reaction. The histamine's role is here tissue growth, repair, and antigen-antibody reaction also. The liberation of the histamine is probably responsible for a number of toxic effects in the man, and any processes involving the mechanical, thermal, radiant damage which will result into its release. That means histamine is not freely available in our body, but any kind of reaction or any kind of antibody antigen reaction is happen, or storage cell can be damaged, then this histamine can be released from that cell, and these are responsible for the number of toxic effects in the man, which may be mechanical, thermal, or radiant damage. Many drugs also cause the histamine release. They include the tobacurine, morphine, ethidine, and some antihistamines and some chemotherapeutic agents also. Then we see what is the relation between the histamine and allergy. Histamine is released in many allergic states due to the antigen-antibody reaction, and the injection of the histamine produces the many of the allergic or anaphylactic symptoms such as the urticaria, that means problem in breathing, bronchoconstriction, hypotension. All these are problems associated with the release of the histamine. It is not easy to understand why antihistamines so rarely relieve the symptoms of some allergic states such as the urticaria, but not others such as the bronchial asthma. These antihistamines are used in the state of the urticaria, that is problem in breathing, but they are not useful in the bronchial asthma. Then it may be due to the fact that the other substances such as the 5-hydroxytryptamine are liberated, or perhaps in some cases antihistamines are unable to reach the site. In some other cases, perhaps histamine is liberated and has to diffuse to other sites such as the blood vessels before acting. That is known as the extrinsic histamine, or antihistamines are then able to complete the histaminergic receptors. Then we see the pharmacological and physiological effect of the histamine. Physiological effect of a histamine release in the body vary from the simple skin rash up to the anaphylactic shock. The effect produced by the histamine release depend on the amount and the site of the histamine release. The effect produced by the exogenously administered or endogenously release of histamine are as follows. If the histamine is released, it shows the different effect on our body. We see these effects associated with the cardiovascular system. In the cardiovascular system, which type of the effect it shows on the blood vessel? It produces the constriction of the large blood vessel in the man. Pulmonary vessels are dilated one. It produces the throbbing, headache, increased cerebrospinal fluid pressure also. Histamine include the headache is because of the stretching of the sensory nerve ending around the cranial arteries. It causes the dilation of the venules, capillaries, and thereby fall in the blood pressure. The administration of the histamine produces the marked flushing in the face and the neck. If we administer exogenously histamine, it produces the marked flushing on the face and the neck. Then large dose of the histamine increases the capillary permeability, resulting in the reduction of the plasma volume. Large dose may produce the reduction in the plasma volume because of the it causes the permeability of the vessel. Then this is the normal our blood vessel. If this process is, that is the vasodilation one, this may be happen naturally or because of the histamine. If histamine is released, there is the capillary permeability is increased one. And in the this is the normal blood vessel, this is the dilated blood vessel. Then we see what is the effect of the histamine on the blood pressure. It moderates the dose, or in a moderate dose, hypotension is of the short duration because the rapid destruction of histamine in the body. But in the large doses, histamine may produce the prolonged hypotension, and if not corrected, may be lead to the shock and the death also. Histamine induced hypotension can be prevented but not reversed by the antihistamines. However, it can be reversed by the adrenaline injection also. Then we see what is meant by triple responses. Intradermal injection of the histamine shows the three responses. These are the three responses. First of all, reading at the site of the injection is described as the flush. Then it is followed by the bright flare. This is the bright flare around that. It is known as the flare. And then development of the localized edema. It is the wheal. This triple response can be shown by the histamine. Then we see the next effect on the heart. Histamine increases the amplitude of the ventricular contraction. It interferes with the AV conduction and also increases the coronary blood flow. In high doses, it produces the ventricular arrhythmia also. Then we see the effect on the smooth muscle. Histamine stimulates smooth muscle of a various tissue directly. Bronchial, uterine smooth muscles are highly sensitive to the histamine. Thus, it shows the bronchospasm. Histamine-induced bronchospasm is effectively antagonized by the adrenaline, isoprenaline, aminophylline, but not by the atropine and the antihistamines. This should be taken in mind. These are not effective against the histamines bronchospasm which is caused by the histamine. In that case, we do not use the antihistamines or atropine. Adrenaline, isoprenaline can give the effects. Then we see the effect on the exocrine gland. Histamine induces increase in the gastric hydrochloric acid secretion even in a smaller doses. In a large doses, shows the increase in the secretion of the pepsin along with the hydrochloric acid. Histamine induces gastric acid secretion by the parietal cells and the pepsin secreted by the chief cell stimulations. It can therefore serve as a useful tool for the studying stomach secretion capacity and to diagnose the achlorhydria, that means the increase in the hydrochloric acid in our body, and the pernicious anemia. Due to the histamine, some human gets, or most of the time, if a histamine is released from the GIT or gastric acid, it increases our gastric acid secretion, and that's why acidity will be increased. And if we take it in a large dose, it will be responsible for the increase the secretion of the pepsin along with the hydrochloric acid. Then we see the adverse reaction associated with the histamine, that are the hypotension, headache, diarrhea, flushing, dyspnea are some commonly adverse reaction. In a clinical uses, we used to study the gastric acid secretion, and in the diagnosis of the leprosy, histamine can also be used. Then we see the histamine receptor. There are two types of the receptor, H1 and H2 receptors. H1 receptor are present in the smooth muscles of the various organs, while H2 receptors are present in the gastric acids. The effect of the histamine occurred through the H1 receptor can be blocked by the conventional antihistamines, while H2 receptor effect can be blocked by the H1 antagonists such as the cimetidine. That means for the blocking of effect of the H1 receptor, we can use the antihistamines, but blocking the H2 receptors effect, we can use the H1 antagonists such as the cimetidine, not the antihistamines. In this session, we cover what is meant by autocoids, then functions of autocoids, allergies associated with the histamine, what is the relation between the histamine and allergy, then pharmacological and physiological effects of the histamine on the different body organs. Thank you very much for attending this session.